Whooping cough. Whooping cough, or pertussis, is an infection of the respiratory system caused by bacteria. It mainly affects babies younger than 6 months old who aren't yet fully protected by immunizations, and kids 11 to 18 years old whose immunity has started to fade. Whooping cough usually starts with cold-like symptoms. They may last for 1 to 2 weeks and can include a runny nose, mild fever, and occasional cough. In many people, it's marked by a severe hacking cough, followed by a high-pitched intake of breath that sounds like whoop. The treatment for whooping cough is usually antibiotics, and early treatment is very important. You may prevent the spread of whooping cough and other respiratory diseases by washing your hands often with soap and water, avoiding touching your face with unwashed hands, cleaning and disinfecting surfaces that you frequently touch, including toys, covering coughs and sneezes with a tissue or upper shirt sleeve, not hands, staying home when sick, and avoiding close contact with people who are sick. Tetanus. Tetanus is an acute infectious disease caused by spores of the bacterium Clostridium tetani. The spores are found everywhere in the environment, particularly in soil, ash, intestinal tracts, feces of animals and humans, and on the surfaces of skin and rusty tools like nails, needles, barbed wire, etc. The disease remains an important public health problem, especially in low-income countries or districts, where immunization coverage is low and unclean birth practices are common. The disease is particularly common and serious in newborn babies and pregnant women who have not been sufficiently immunized with tetanus toxoid-containing vaccines. These are the most common symptoms of tetanus: stiff jaw, also called lockjaw, stiff abdominal and back muscles, contraction of the facial muscles, fever, sweating, painful muscle spasms, especially near the wound area, and trouble swallowing. Tetanus is a medical emergency requiring evaluation and care in the hospital. It can be prevented through immunization with tetanus toxoid-containing vaccines, TTCV. Bubonic plague. Bubonic plague is an infection primarily spread to humans by infected fleas that travel on rodents. Historically, it was responsible for widespread pandemics with high mortality. During the 14th century, it was known as the Black Death, causing more than 50 million deaths in Europe. However, nowadays, plague is easily treated with antibiotics and preventive measures. Plague manifests as a severe disease in people. Patients develop symptoms such as fever, headache, chills, and weakness. They may also experience swollen, painful lymph nodes, called buboes. The bacteria multiply in a lymph node near the point of entry into the human body. If left untreated, the bacteria can spread to other parts of the body. Antibiotics and supportive therapy are effective against plague if patients are diagnosed promptly. Diphtheria. Diphtheria is a serious infection caused by strains of bacteria known as Corynebacterium diphtheriae. The bacteria most commonly infect the nose and throat, and once a person is infected, they release dangerous substances called toxins. These toxins can spread through the bloodstream and often result in a thick gray coating forming in the nose, throat, tongue, and airway. The transmission of diphtheria occurs from person to person, usually through respiratory droplets from coughing or sneezing. Infection can also arise from touching infected open sores or ulcers. The most visible and common symptom of diphtheria: fever, chills, swollen glands in the neck, bluish skin, drooling, and a general feeling of uneasiness or discomfort. In some cases, the toxins released by the bacteria can damage other organs, leading to potentially life-threatening complications, such as myocarditis, paralysis, and kidney failure. Diphtheria is extremely rare in the United States and other developed countries, largely due to widespread vaccination. However, it remains prevalent in many countries with limited healthcare or vaccination options. Prevention of diphtheria is primarily through vaccination, typically administered in childhood. Practicing good hygiene, such as regular hand washing, can also help prevent the spread of the bacteria. For those exposed to diphtheria, prompt treatment with antibiotics can prevent the progression of the infection. If diagnosed with diphtheria, the first step of treatment is an antitoxin injection, followed by aggressive medical care, as recommended by a doctor. Pneumonia is an infection of one or both of the lungs caused by bacteria, viruses, or fungi. It is a serious infection in which the air sacs fill with pus and other liquid. Signs and symptoms of pneumonia may include chest pain when you breathe or cough, confusion or changes in mental awareness, cough, which may produce phlegm, fatigue, fever, sweating and shaking chills, nausea and shortness of breath. Treatment and prevention of pneumonia include rest, hydration, and symptom management. Prevention strategies involve good hand hygiene, avoiding smoking, and reducing exposure to pollutants.